Well, minutes and hours after, of course, Prime Minister Narendra Modi announced a 21-day lockdown in order to contain the spread of COVID-19 in India, online retailers and grocers went on their decision of either suspending their operations or curtailing them for a while. In fact, Twitter and social media sites have been filled with videos that talk about how certain delivery executives were thrashed and physically hit by policemen across the country. Well, in this Mojo report, we bring you certain exclusive information on this story and the kind of problems and consequences that are arising for online retailers in order to, of course, send out important and emergency services like that of, in fact, food, vegetables, groceries, or medical supplies to people who live far away and cannot, of course, travel to commute or cannot commute to even a nearby medical store. In fact, Big Basket mentions in a couple of releases that two of its employees were hit, and while if you also find the co-founder of MedLife put his own video on Twitter mentioning that his own delivery executive was thrashed by police in Delhi. Well, these are videos that are talking that have come into, of course, news after the lockdown and have been shared by people and netizens across the country talking about that this is something that shouldn't be allowed. Well, the latest is that the government has now made it a point in order to issue identity cards to delivery executives in order to have a safe movement of them across cities and countries. But is that going to happen anytime soon, and will that solve the problem?
Hi, my name is Anant Narayanan. I'm the co-founder and CEO of MedLife. At MedLife, we deliver medicines, mostly to chronic patients. We also do diagnostic tests at home and telemedicine and online consultation. Over the last 10 days, given the coronavirus situation, we've had a huge upsurge in orders. We are a big believer in social distancing and applaud what the government has done in terms of the 21 days lockdown. However, as the government has rightly pointed out, and our Prime Minister has rightly pointed out, we need to allow essential services to actually operate. I wanted to call out a couple of incidents that have happened yesterday to several of our associates at MedLife. One in Delhi and one in Bangalore, both with curfew passes. The one in Delhi had a curfew pass. Both have been lathi charged and have actually gotten hurt as they were going out about their job in terms of delivering medicines, which is an essential service. I believe that people who are risking their lives to deliver medicines in a situation like this should not be put in trouble. It also leads to a huge level of issues around motivation for the rest of our employees. My sincere request, I think, to all of our police services is, I think, while you're doing your job, I think dealing with this lockdown in a compassionate manner and differentiating between essential and non-essential services is critical for this lockdown to be successful.
It was very sudden and it caught people by surprise, and the ability to communicate or put the process and systems in place to be able to implement this to the final level, that is up to the policemen in each of the districts on the street, that time was not available. So we started the first day with a lot of confusion, and it's not allowed. So we have companies that are in three distinct essential services category. One is Big Basket, which is into groceries, online, Portea Medical, which is into home healthcare, medical equipment, online and delivered at home. And third is FreshMenu, which is online food delivers the food to home. So all the three faced huge amount of challenges, primarily because communicating to the cop or policeman on the street was very difficult. Over the last, I would say, 48 hours, that means yesterday and most of today, we have managed to discuss with each of the states, government official and the police commissioners, try to put some kind of systems in place. Not yet completely done. It's work in progress. I think it will take another 24 to 48 hours before we say 90% it has been solved. So the key issue is, there are three key issues that are being faced, that are challenges, primarily arising out of the fact that implementing this has had no time and that is what we are doing after the announcement came in. The first thing is last mile, a worker, doctor, nursing at home or to patient's home. Second, or how do I get the big basket delivery boy carrying the goods to be able to come there? Or FreshMenu case, how do I get the food to your home? This is one challenge. The second challenge has been on the supply chain side. See, all the companies, even though these are essential commodities, are identified, declared as essential commodities, exempt from lockdown and curfew. How are we going to get the supplies into these stores? Getting essential commodities into cities requires interstate movement, crossing the state border, which again the people who are manning the borders don't know. It's just the border is closed. There are no couriers, interstate couriers available. So the ability to be able to get essential goods into the city is the second challenge. The third challenge is movement of people. For example, we require warehouses of big basket, kitchens of FreshMenu, stores of Portea medical where the equipment are placed. We need to get people from their homes, employees from the homes to here. How are they going to travel? They are not carrying any essential goods. So if a cop stops them, we don't know whether the cops don't know whether this person is doing essential service or not. Anybody can claim. So that is the third challenge.
Right,
so
sir. But sir, for
challenges.
this, didn't the government promise you that they're going to be giving certain kind of identity cards? Have they been issued?
Yeah. So see, the announcement came, like I said, roughly around 40 hours back. The announcement came. After that, it was night. They started putting the process in place to issue it. Given over 730 districts and 1.3 billion people, the number of passes required is humongous. How do they issue the passes? How do they validate it? How do we collect it during lockdown? All that is still work in progress. Some passes have been issued. Fraction of what is required by the whole industry to deliver essential services. More and more are getting issued, and it's work in progress. Take an example. In Hyderabad, we got 5 passes for a day. The Portea medical I'm talking about. We do 700 visits a day with 695 people. Elders, chronic patients, I cannot reach them. Now, I don't blame the government.
And have people still be calling for Portea services? I mean, are there still calls coming that they require medical services at home?
Oh, yes, absolutely. See, we have 4,000 people across 16 cities. We were servicing before the lockdown. We were doing close to 4,000 visits a day. 4,000 visits a day. That is our normal service. Forget about new people. This is the service to our existing customers. Then because of this lockdown, it has substantially increased because people cannot move. Hospitals are closed. Hospitals are attending to serious patients and cases. For less serious cases, the hospitals are not able to attend because hospitals are also understaffed. They don't have doctors and nurses who are not able to reach there. So the home healthcare, the need for healthcare home has structurally shifted. Huge amount of demand. So therefore, not only we need to be able to service our existing things, the current demand is phenomenal. Also remember, the coronavirus, the COVID-19, its most vulnerable people in the situation are the elderly, are people with predisposed conditions.
Right.
Yesterday, for example, we had to do home chemotherapy for a patient. Portea Medical does home chemotherapy. This is through a chemotherapy drugs submitted by, produced by an MNC pharma company. We were not able to get the drug because interstate couriers were not available. So home chemotherapy could not take place. So this comes under the category of the second challenge I told you, interstate cross-border movement.
Right, sir. But keeping in mind, sir, this is definitely something that is an essential need. I mean, there are a lot of people who might not, who are not allowed to get out of homes. A lot of people who might not have general store at a walkable distance, not even probably few, a walk of probably not even 5 minutes away. So what is the solution for a situation like this? I mean, what if things don't work out in 48 hours?
The solution to this is working with each state government, police officials in each location, one by one, and resolving it with them how to ensure the essential services are not disrupted, the people delivering food, healthcare services, groceries, going into the warehouse to keep essential services open are able to work without any hindrance or difficulty. We are doing that. Very positive that in the next 24 to 48 hours we will be able to crack almost 90% of the locations. The government authorities are very supportive. The challenge is coming because it cannot be done centrally. We do need technology based scalable solutions. Issuing of curfew passes and daily passes currently that's being done is a small fraction of what is needed, and that's not really scalable. The number of such passes required by people, the vehicles that are carrying essential services are too humongous to be done manually. I expect that in the next 48 hours we would find good solutions to the problem. Everybody is working concertedly to address this. From the side of the startups, the companies, and the private sector, we need to contribute to the solution. We need to ensure that we restrict only to essential services to supplies and not use the opportunity to bundle other non-essential services. So we also have a responsibility to cooperate with the government to implement.